Hi, I'm Dr. Robert Stanley, and today I'd like to introduce to you britegums. So a patient presents in your office and they look like this in the hygiene chair. And when you look at that and you want to record in the patient's in their chart, what do you call this? What do you call this? Now, this patient has looked like this their entire life and they're completely healthy. So what do you call the gingival pigmentation that you see on their gums? Now, I've been asking this question to a number of doctors over time, and here's a word cloud. So the bigger the word, the more likely doctors have responded with this as being the word that they call it. So you can see there is a plethora of words that are used to define that situation. Now, in this journal article, what they say is that it's very common to see pigmentation in the oral environment. And I think that this is a very clean way of organizing them into two main categories, focal and diffuse. So in this illustration right here, you can see on the A picture that we have a focal pigmentation, most likely a amalgam tattoo, for instance. But on the middle one, we have multifocal, or we could call this blotchy, where we have areas of pigmentation and areas of pink. And then the one on the far right, letter C, is diffuse. So now that we have the common understanding, what we've done is created britegums. So britegums is the gingival uniformity modulation system. In other words, taking gums that are non-homogeneous and making them uniform. This is a prime example of one of these procedures. So you see on the left, the patient presents with blotchy gums and says that they've been being teased since they were 11 years old about the nature of their gums. Now the gums are healthy, there's nothing wrong with them, they were born this way. And then the picture on the right is 5.5 years after the initial treatment with britegums, and we were able to pinken the gums. So you may be wondering, is this an issue? The World Health Organization defines health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I take offense when people say you're a cosmetic dentist, that doesn't mean that you're doing something for the patient's health based on this definition. This procedure is an elective cosmetic procedure. So what we've done is we've surveyed two groups of people. People that have presented to the office with pigmented gums and people that are dentists. And here's what we found. On the left-hand side, we found that 64% of people that present with blotchy or dark gums are interested in learning about gum pinkening. On the right-hand side, what we found is that 75% of doctors have no idea that there's a solution out there. Historically, dentists over the many decades have tried to do gum pinkening, and the problem is they haven't been successful. The main reason why they haven't been successful is that the techniques they used weren't completely effective. So in 2017, we filed for a patent on the britegums technology, and here's how it works. We have an electrode, or a brush, that is connected to a radio. And when we energize the radio and brush across the gums, with the electrode, what we do is effectively separate the epithelium from the connective tissue, leaving the connective tissue intact below, but removing all of the epithelium. And as you recall from school, the epithelium is where the melanocytes live. So if we remove the factories that create the pigmentation, the likelihood of a rebound is extremely low. In fact, what we did is we did a histological study on this particular procedure. It is being published in 2023 in February, and it's called this: Human Histological Verification of Gingival Uniformity Pinkening via Selective Radiofrequency Ablative Deepithelialization, because we couldn't get any more words on one slide. That's all we could do. But it's coming out in this journal, in the International Journal of Periodontics and Restorative, and here's a little snapshot. The histological study did this. So you will recall that the epithelium sits on top of the connective tissue, and it has the reedy pegs, and the connective tissue has the connective tissue papilla. And if you imagine this connection like two pieces of Velcro, and the top piece of Velcro is red, and the bottom piece of Velcro is white, we effectively can separate the top piece of Velcro from the bottom, leaving the bottom intact. Here on the left is the histological evidence of our claim. On the left, you see someone who's presenting with a lot of melanin in the dark purple area. The light pink area towards the bottom of the screen is connective tissue, collagen. That's where our blood supply is, that's where our nerves are. On the right-hand side is immediately after the application of the britegums procedure. Now, the interesting thing about what you see on the right-hand side is that those are the connective tissue papilla still intact. And why is that so important? It's so important because if we can get down into the little valleys between the papilla and we remove 100% of the epithelium, then the chances of rebound, which has been replete in the industry for all of the other techniques, is negligible. And then this is how the patient presented 6 months after procedure. The britegums and the connective tissue papilla are not mature in this picture, but you can clearly see that there are no melanocytes in this or pigmentation. This is how a patient would actually look minutes after the procedure. So on the left, they present, the patient gets numb with just local infiltrations, and on the right is just minutes later. And what you're looking at there is the connective tissue with the epithelium gone. So you're doctors, so you want to see a little bit closer. So here, we're going to zoom in on a lower case and look really, really close. Now, what I want you to do is take a second to notice that the white area, which is the connective tissue or the collagen area, still retains the stippling. So look close and you'll see the stippling on this image, which is really, really unique to this procedure that can't be done with the other procedures. So like a laser, which you have no depth control when you shoot the laser onto the tissue, you don't know how deep it's going. So in this case, we're stopping right at the connective tissue, and you can see it's not hardly even bleeding, which is a great thing for the patient. So here's some before and afters on some headshots that you may be interested in seeing how it looks. So before on the left and on the after on the right. Here is our ground zero patient, which was Dion, who is a former NFL football player who came to us. And I mentioned earlier, he was the one that was being teased when he was 11 years old and had been teased his whole life about it. And he couldn't be happier, as you can see by the image on the right-hand side. And this afflicts mostly people that have more pigmentation naturally in their skin. But it also afflicts people that are smokers. So you can have the same situation with a smoker's melanosis. It is definitely something that children that are getting picked on at school, this is a great procedure for them because no one today needs any more pressure on them, especially our youth, than they already have. And so giving them an option to come in for one quick procedure to turn from the left to the right is really nice. And as we step through these, each one of them is really smart, really happy. And then let's get in a little bit closer so you can see some of the effects that we have here. Now, it is possible that sometimes you might need to do a touch-up, and the way I like to explain this is that if you ever painted a room, it looks great when it's wet, but the next day, sometimes when it dries, you'll notice that there's an area that might need a touch-up. So britegums is the same way because we're painting across the gums with the brush. And when we're done, we think we've got it all, but every once in a while we may have missed a spot. And if we do, we just come back and touch it up. And we don't have to do the entire arch, we just do the spot that needs touch up. Sometimes in these cases, we'll also do a gingivectomy or aesthetic crown lengthening in order to harmonize the smile. And you may be wondering, what's the post-op like? So after one of these procedures, what's it like? Well, on Dion, the former football player, he didn't take anything and he was fine. He had zero pain, but he's used to playing with pain. Most people take about 3 to 4 days before they feel like they're kind of over the hump. And they have to be careful with things like salty foods or acidic foods that might sting or burn the gums while they're healing. But what we like to do is give the patient a care package when they leave. And the main ingredient in our care package is the Stella Life products. So there are 3 products that you can get from Stella Life. One is a rinse, one is a gel, and one is a spray. Now for these procedures, we don't use the gel. And the reason we don't use the gel is because I can't rely on the patient not to stick their finger with the gel in the mouth and to avulse the new skin that's growing. So what we do is we recommend the spray, which we spray under the sublingually, and it's absorbed for pain and swelling and healing, and the mouth rinse. And we tell them to use the mouth rinse not like the Listerine commercials because that's way too vigorous. What we say is put it in your mouth, imagine it's your favorite color, maybe Carolina blue, I don't know, and then move it around lightly and then just let it express lightly and leave the residual on your gums. Do not rinse it off right away. And then with time, what we have is what we call the butterfly effect, because initially what's going to happen is the gums are going to form a fibrin clot. And if you've ever looked at a fibrin clot 1 or 2 weeks after an extraction socket, it's quite scary for the patient, and you look in there and you see the nice yellow clot in there and you go, yes, it's healing perfectly. Well, when that is on the gum tissue, it's quite frightening at first for the patient, so you give them a little warning. It's going to look ugly for a couple weeks, but it's called the swan effect. Butterfly effect. It goes away, and when it goes away, it's pink underneath. By 6 weeks, the gums are fully mature and beautiful and pink. When I do my full mouth cases, so all on X type of cases, I give the full package of all 3 products that Stellalife has to the patient. Obviously, with full mouth, you're doing a pretty extensive surgery, removing all the teeth, leveling the bone, placing the implants and the prostheses. So this Stellalife product is great for those people too, and they get great outcomes from that. So in closing, britegums is an elective cosmetic procedure. It's only necessary for people where this presentation bothers them. It's not governed by insurance, which is great for everyone. Whether you're working in a DSO or whether you're working for fee-for-service, it doesn't matter. It's not covered by insurance, so you can set your own fees. It's highly desirable by people that want this. They just don't know it's available. And as more and more people start to offer this service, it's probably going to become, as the word pinkening is probably going to become as common as the word whitening. It has a low capital investment, meaning your hardware to get started is extremely low. The incident cost for doing each case is extremely low. The procedure itself takes no more than 12 minutes to do, top and bottom arch. It's self-limiting, which means that the electrode or the brush will not damage the connective tissue. It will not go down and do damage, which is beautiful for people that want to be able to do this procedure and they're worried about their hands. You don't have to have great hands to do this. And there's little to no discomfort, as we mentioned, especially with the Stellalife. And I use it with this kind of concept of permanent warranty issue, which comes to the next one, which is a patient retention. So what we tell people is, listen, as long as you remain a patient of good record, a good standing, coming for your cleanings every 6 months, we will 100% guarantee that if you have any rebounds, we'll do the touch-ups complimentary. Because of the low incident cost, we can offer that, and because of the effectiveness of the procedure, no one's ever needed to take us up on it because it doesn't need to happen. And it's got an easy learning curve. So that was my presentation on britegums. If you're interested in britegums, feel free to go to britegums.com to learn more.